Most men don't realize that your penis ages just like your heart, your brain, or your bones. Ignoring this doesn't just reduce function, it also means losing confidence, dignity, and connection. Hello everyone, I'm Dr. Natalie Teo. I'm a urologist and medical professor here in Singapore with over 30 years of experience in men's health, specializing in helping older men preserve not just their sexual function, but their identity and quality of life. Let me tell you something that might surprise you. The main cause of penile dysfunction in men above 60 has nothing to do with age, and a simple daily habit without medication could change everything. In this video, I'm going to share 5 essential ways to care for your penis, backed by science and designed specifically for men over 60. These aren't tricks lah, they're real practical strategies that can save your health and quality of life. And don't miss this because I'm also going to reveal an extra tip that most doctors never mention, but it can prevent one of the most painful penile conditions we see in older men. Before we start, if you haven't subscribed yet, please click that button and turn on notifications so you won't miss practical health tips adapted for your age. If this topic interests you, write number 1 in the comments. If you think I could improve or explain something better, write 0. Your feedback helps me serve you better. Let's start with the first and perhaps most misunderstood part of penis care as you age. Keeping it active, because the truth is, when you stop using it, your body starts losing it. Number 1. Stay sexually active, even without intercourse. When I talk to men in their 60s and beyond, one of the most common misconceptions I hear is this: I suppose my sex life is over already lah. Many have silently accepted the idea that sexual function disappears with age and there's nothing they can do about it. But let me tell you something important. This belief is not only false, it can actually be the main cause of deteriorating function. Your penis, just like your muscles, heart, or brain, depends on use to stay healthy. When it's inactive for long periods, blood flow decreases, elasticity weakens, and tissues can start to atrophy. This isn't scare tactics, it's basic physiology. The term we use is penile atrophy from disuse, and it's far more common than most men imagine. The good news is it's completely preventable. Sexual activity, including masturbation, isn't just about pleasure, it's about preservation. Maintaining regular blood flow to the area keeps tissue healthy, oxygen supply strong, and function intact. Think of it like stretching a muscle to prevent it from tightening over time. And if intercourse or solo stimulation aren't possible or comfortable at that moment, no problem. There are other methods like using a medically approved vacuum erection device or even doing pelvic floor exercises that promote circulation and performance. I had a patient, Mr. Lim, 68 years old. He came to my clinic feeling quite down because he thought his active days were over. After we talked, and he started doing pelvic floor exercises 3 times a week. Combined with regular activity, within 3 months, he told me, "Doctor, I feel like myself again. The most important thing is not to remain inactive. Your body responds to use regardless of age. Beyond the physical benefits, there's another equally essential layer: dignity and identity." For many men, sexual vitality is tied to how they see themselves. When that starts to fade, confidence often disappears along with it. But staying active in whatever way works best for you can help you reclaim not just performance, but pride. It's not about being who you were at 25, it's about staying connected to who you are now as a man with wisdom, experience, and courage. I've seen men in their 70s regain control of their sexual health simply by taking this first step. And often when they do that, other aspects of health also start to improve. It's a domino effect lah. Confidence, intimacy, motivation, everything is connected. Now that you understand the importance of staying active, let me show you something equally crucial. It's something every man thinks they control until it's too late. Let's talk about hygiene. Number 2, keep it clean. The right way. This might seem obvious, but after 3 decades treating men in my practice here in Singapore, I can guarantee you that proper penile hygiene is one of the most overlooked yet absolutely essential forms of self-care, especially as we age. I've seen too many men come to my clinic with infections, irritations, or even more serious conditions simply because no one taught them how to clean properly. It's not about being dirty, it's about not knowing how age changes the body and how to care for it. As we get older, skin becomes more sensitive, immune response decreases, and the body doesn't fight bacteria or heal irritation as quickly. This means hygiene that was sufficient at 30 or 40 years old is no longer enough. If you're uncircumcised, this becomes even more important because bacteria, sweat, and dead skin can accumulate under the foreskin, causing infections like balanitis or conditions that increase the risk of penile cancer. Yes, cancer. And it's not rare. Some countries have high rates of penile cancer, and the main cause is poor hygiene. This risk doesn't disappear with age, it increases, but the solution is simple. Wash gently with warm water and mild, unscented soap. Nothing harsh. Retract the foreskin if you have it, rinse well, and most importantly, dry thoroughly. Moisture can be a breeding ground for bacteria, especially in skin folds. Always clean after sexual activity too. Vaginal fluids, lubricants, or even sweat and natural oils can alter the balance of healthy skin bacteria. It takes just 1 minute, but this small daily habit can save you from painful infections, bad odor, or something much more serious. What surprises many men is the emotional shift this brings. When you care for your penis like you care for your teeth, your heart, or your appearance, you start to feel different about yourself. Cleaner, more confident, more in control. And that's powerful, especially in a world that often tells older men to step aside or give up on their own bodies. But hygiene is just the beginning. There's something else you need to know, something most men don't talk about until the damage is already severe. It all starts with what happens during intimacy when you're not fully ready. Let's talk about a hidden danger that almost no one warns you about. Number 3, avoid sexual activity with a semi-erect penis. This might surprise you, but it's something I see very frequently in my clinic. Men who injure themselves without realizing during intimacy simply because they weren't aware of the risks of having relations before full erection. It might seem like a small detail, especially when desire and the moment take over, but attempting penetration with a semi-erect penis can cause cumulative damage, and the consequences can be life-changing. Let me be clear. Your penis isn't just a tube of skin. Inside is a delicate structure of blood vessels, spongy tissue, and smooth muscle. When it's not fully rigid, it doesn't have the support to withstand pressure. That's why forcing it to function before its time can cause what we call micro-traumas. These are small internal injuries that might not cause immediate pain, but gradually form scar tissue below the surface. Over time, this scarring can harden and pull the surrounding tissue, causing Peyronie's disease. If you've never heard of it, it's a condition that causes painful curvature of the penis, sometimes so severe it makes intercourse difficult or even impossible. I've met many older men who were embarrassed to mention the changes they noticed until it was too late for conservative treatment. And the truth is, most didn't even know this risk existed. I remember one gentleman, Uncle Chen, who came in quite distressed, and he said, "Doctor, I didn't want to bother you, thought it would get better on its own." By then, the curvature was already significant. If only he had known earlier to wait for full erection, we could have prevented it entirely. So, I want to tell you now, go slowly. Your health, your comfort, and your confidence depend on treating your body with patience and respect. Waiting for full erection before sex isn't just safer, it's smarter. It protects you from long-term damage and ensures sex is pleasurable and pain-free. Use lubricants to reduce friction and take your time with foreplay or stimulation. Talk to your partner if you feel pressure to rush things. It's not worth the risk. And if you use medications or aids for erection, let them take full effect before continuing. This simple precaution can save you years of discomfort and frustration. It's not about being fragile, it's about being informed and empowered. Now that you understand how to protect your body during intimacy, we need to focus on something that affects not just the body, but also the brain. And it's one of the biggest hidden threats to connection and real desire in older age. Let's talk about the unexpected cost of excessive pornography. Number 4, limit pornography, maximize real connection. I want to be honest with you, man to man, we live in a time when access to adult content is easier than ever. And for many older men, especially those who are single, widowed, or feeling disconnected, it might seem like a harmless way to keep desire alive. But after working with thousands of patients over the years, I can assure you this. What starts as occasional relief can gradually become a substitute for something much deeper and more rewarding, and it can steal the connection you deserve. The truth is that excessive consumption of pornography rewires how the brain responds to arousal. It often conditions the mind to depend on a very specific type of stimulation, fast, visual, and solitary. Over time, this can lead to what we call desensitization, where intimacy in real life doesn't spark the same excitement. I've heard men in their 60s and 70s tell me they feel confused. They still have desire, but when they are with their partner, the body doesn't respond like before, and they believe something is broken inside them. But in many cases, it's not physical, it's psychological conditioning caused by overexposure to pornography. One patient told me quite candidly, "Doctor, I can watch on my phone, no problem, but with my wife, nothing happens. I feel so ashamed." We worked together to reduce the screen time and focus more on real intimacy with his wife. After a few months, he came back smiling. "It's coming back lah, doctor. I just needed to retrain my brain." Moreover, excessive consumption can generate feelings of shame, isolation, and low self-esteem, especially when it becomes a private routine that replaces human closeness. You start questioning your masculinity, your ability to connect, and your worth in a relationship. It's a heavy burden, especially when you're already dealing with the emotional challenges of aging. I'm not here to shame anyone. I don't judge you, but I recommend moderation. Use sparingly, if at all. Focus on rebuilding your natural pathways of arousal through memory, imagination, or true emotional intimacy. This might mean dedicating more time to foreplay, talking openly with your partner, or simply allowing yourself to feel without pressure or expectations. Desire doesn't die with age, it just needs different attention. Limiting pornography doesn't mean giving up pleasure, it means reclaiming it in a healthier, more meaningful way. It's about recovering harmony between body and mind so you can experience true connection, not just stimulation. And speaking of harmony, there's one last piece of this puzzle that ties everything together. It's the foundation that sustains not just your sexual health, but your overall vitality. It's what drives your confidence, your performance, and your ability to fully enjoy life. Let's talk about lifestyle.
Number 5, prioritize lifestyle over pills. If there's one truth I've learned after decades treating men over 60, it's this. Your lifestyle reflects your sexual health more than any prescription. Many patients come hoping for a quick fix, a magic pill to recover what they feel they've lost. But the reality is that no medication can compete with the power of consistent, healthy habits. Your lifestyle is the engine that drives everything from your blood flow to your hormone levels to your mental sharpness and yes, your ability to perform and feel like yourself again. The connection between lifestyle and sexual health isn't just anecdotal, it's biological. Erections depend on good blood flow, and blood flow depends on heart and vessel health. When you smoke, drink excessively, or eat poorly, you damage those vessels and limit circulation to the most vital parts of the body, including the penis. Erectile dysfunction is often one of the first warning signs of heart disease, and it's your body's way of telling you something deeper might be wrong. I had a patient, Mr. Tan, 65 years old, heavy smoker for 40 years. He came in complaining about performance issues. After some tests, I told him, "Mr. Tan, your heart also not so good leh. Let's fix the lifestyle first." He quit smoking, started walking around the HDB estate every morning, changed his diet. 6 months later, not only did his performance improve, but his cardiologist was amazed at how much his heart health improved too. But here's the good news. Every healthy decision you make today has immediate and lasting effect. When you stop smoking, your circulation improves within days. When you reduce alcohol, your testosterone can start rebalancing. When you start walking 30 minutes a day or eating foods that support vascular health like vegetables, leafy greens, and fatty fish, you're not just extending your life, you're enriching it, right? You recover energy, increase confidence, and gradually your function starts to follow. What excites me most is seeing a man realize his body isn't broken, it's responsive. It's waiting for you to come back and care for it like you've cared all these years. I've seen patients radically change their lives just by changing their daily routine. They sleep better, laugh more, reconnect with their partners and with life, and they stop depending on pills because they've built something more solid, a foundation. So before seeking another prescription, put on your walking shoes, choose water instead of whiskey, prioritize rest, connect with others. Your body listens to how you live, not just what you swallow.
Now, there's one last tip I want to share. It's simple, but surprisingly powerful.
And most men haven't even heard of it. It happens while you sleep and could be the key to protecting your virility as you age. Let's talk about something unexpected. What you wear or don't wear to sleep. A bonus tip, sleep without underwear. This might seem like an insignificant detail, almost too simple to matter, but over the years I've learned that it's the most discreet habits that have the most surprising impact. Sleeping without underwear is one of those habits, and when you understand why, it will change your perspective on nighttime comfort and long-term health. During sleep, your body enters a natural state of repair and regulation. In men, part of that process includes spontaneous erections during the night, something completely normal and essential for keeping erectile tissue healthy and oxygenated. But when you wear tight underwear, especially briefs or tight pajama bottoms, you might be compressing your penis without realizing during those nocturnal erections. Over time, that pressure can cause tissue irritation, reduce blood flow, and in some cases, formation of internal scarring. These scars, especially if they go unnoticed for years, can cause Peyronie's disease, that painful penile curvature I mentioned earlier. It's much more common in older men than most people imagine. Simply choosing to sleep naked or in loose boxers gives your body the freedom to recover naturally without unnecessary friction or compression. It might seem like a small change, but I've seen it make a big difference for men trying to preserve comfort, functionality, and confidence. One of my patients laughed when I first suggested it. He said, "Doctor, you serious? Just sleep without underwear can help?" I told him, try it for 1 month and see. He came back and said, actually quite chocolate, and I sleep better also. Sometimes the simplest changes make the biggest impact. You know, after everything we've talked about today, I want to tell you something from my heart. I know that for many men, especially from 60 onwards, talking about sexual health can feel uncomfortable, even unnecessary. But the truth is, your relationship with your body doesn't end with age. It evolves, and how you care for it now matters more than ever. What did we cover today? Keeping the penis active, proper hygiene, protection during intimacy, limiting overstimulation from pornography, having a healthy lifestyle, and yes, even sleeping without underwear. These aren't just medical advice, they're small acts of self-respect. Each one reinforces your dignity, your vitality, and your connection with yourself. I've had the privilege of helping countless men rediscover confidence in their bodies, not because they sought youth, but because they decided to care, stay committed, and treat their sexual health as an important part of overall well-being. You're not alone if you've been struggling in silence or don't know where to start. And the good news is it's never too late. Every day offers the opportunity to do something different, make a better decision, and take a step toward regaining control. Your health doesn't define your worth, but it reflects your attention. And when you care for yourself in these simple, powerful ways, it shows in how you walk, in your relationships with others, and in how you feel inside. Many of you have asked me about prostate issues too. I see it in the comments, men taking finasteride, doxazocin, tadalafil, wondering if you'll need medication forever. Let me tell you this. While medications help manage symptoms, the lifestyle changes we discussed today can significantly improve your prostate health too. Regular activity, good circulation, healthy weight, these all support prostate function. It's not about replacing your doctor's treatment, but complementing it with habits that give your body the best chance to heal and maintain itself. For those of you who wrote to me asking about age, whether you're 59, 68, 75, or 81, I want you to know this. I've seen improvement at every age. The gentleman who's 81 and shared his story in the comments, your dedication to treatment and your positive spirit inspire me. Keep going. Your body is still capable of healing and adapting. Thank you for being here, for listening, and for choosing to invest in yourself. You've taken the first step. Let's walk this journey together for men's health, because taking care of yourself should never be shameful, and it's never too late to start. If this helped you, please share it with someone who needs to hear it. Take care, and I'll see you in the next video.